Good evening. Welcome, welcome, welcome to 20-Minute Fashion Distraction. I'm Jackie Jenkins. You know what we do every Wednesday night. We talk total fashion. I hope that everyone had an amazing week. Tonight, just like we have done every Wednesday night, we are going to have a discussion about an aspect of fashion, an opportunity for questions, and an opportunity to talk. One thing I do want to throw out is we were not on last week because there was the inauguration. So this week we're back. And for the month of January, the focus has been really creating that amazing you. And so tonight, as a part of making sure we have the amazing you, I have Dr. Alban Burke with me. And we are going to talk about fashion, but really our best accessory, which is our smile. So hold on, I'm going to bring on Dr. Burke. Hi, Dr. Burke.
Good evening, Jackie. How are you?
I am wonderful. I am wonderful. So one of the things that I say on the fashion distraction is I like to sing people's praises while I can see them. And so I want to take a minute and sing your praises and introduce you to the audience. Dr. Burke is actually my Morehouse brother, who actually, after leaving Morehouse, went to New York University to study dentistry, did his internship at Mount Sinai, and has done his residency at Columbia. And one of the things that I think is really wonderful about not just having dynamic people, but dynamic people that have been friends for so long. So I'm excited that you are here and were able to join me on the Fashion Distraction. So thank you for making the time. And I see some of our classmates and buddies are here. Jocelyn's here, and so is Courtney and my sister. So thank you guys for showing up. And so I just want to get right into it. Tonight's show, as I was explaining to the audience, for the month of January, we focused on making our best selves. And there's no better accessory that I can think of than our actual smile. So when we had a chance to talk, one of the things that you wanted to make sure we talked about is what exactly is a healthy smile?
So yeah, first of all, I'm excited as well, and thank you for having me. I appreciate the invite. So certainly a healthy smile. What is more sexy, what is more attractive than a healthy, beautiful smile? A healthy smile, we always want to begin with the oral health. I mean, I think the anatomy of the gums and the teeth have to be healthy. I mean, we want our patients always to floss. We always say in the office that if you had an opportunity to either brush or floss and you had to do one or the other, flossing is absolutely much more important for the long run, the health of your soft tissue. And it resounds health. I mean, when you see a healthy enamel and healthy gums, it's a reflection on the person's overall health as well. And once again, there's nothing like a beautiful, healthy smile. So it fits with any outfit, by the way. So,
right, tie it in total.
Yeah.
And so, can you share a little bit about, like, one of the things that we talked about were the whole thought of teeth whitening and adult braces. Can you talk a little bit about those and just how we may even want to think about them?
Sure. A lot of people, I think today's world, bleaching and tooth whitening is almost commonplace. In fact, there are a lot of really effective products over the counter. Certainly we do it professionally in the office. Believe it or not, most patients don't actually need that level of bleaching, and it's an individual thing. There are a lot of effective products over the counter that really get you that white pop, and the research and development in these products are so healthy at today's point. If you follow the directions effectively, I don't necessarily like to push products, but a lot of them really work well. As far as teeth movement and braces, we all know about the aligner products. Invisalign is one of the products that orthodontists and general dentists use to manipulate and straighten teeth. Believe it or not, today's world of orthodontics is about almost 50% adult.
Oh, wow.
45% adult. Yeah. So the stigmatism and the cosmetics that we previously associated when we were younger with braces do not exist. I mean, they're clear, they're tooth colored, and once again, they're effective as well. So, Invisalign is one of the brands of these clear, that we refer to them as aligners.
Mm-hmm.
But yeah, it's about 45% adults today that are actually in active orthodontic treatment.
So actually, to that point, and there's I see my mother. Actually, my mom is here. That's lovely.
Good evening, Mom.
a few of the sorors. I see Zena. I see Jackie, and I see Courtney. So hey guys. But I see the question about the Invisalign. So you touched on that, but can you talk a little bit? There's a question about is teeth whitening and bleaching, can that be dangerous? And also, can it be translucent?
Yeah, that's a real specific question. Real good question. So if you are going to take on bleaching on your own, it's probably a good idea to have a specific assessment with your dentist. And I think the dentist will have a better idea what would be more specific and appropriate and healthy for you specifically. Because once again, whether it's doing the in office bleaching or the products over the counter, they're not for everyone. So they have to have a certain type of specific situations that will require a certain type of product. So, or type of bleaching. So it potentially can be dangerous, but I think with the guidance of your professional, that's probably the best way to go.
Awesome. And I forgot one of the most important questions. What's your area of specialty?
Actually, I'm a general dentist. I do most of the concentration as far as treatment. My last 10 years of practice is typically cosmetics, implants, veneers, porcelain jackets, crowns. So it's not a essentially recognized specialty, but that's what I've been doing 10 years. So
okay,
that's what I kind of focus on these days.
Awesome. I see a question about what are the benefits of swishing?
The benefits of swishing.
And I don't even know what swishing is. So wait a minute. So do you know? I assume it isn't. Thank you, Spash.
So maybe they could be a bit more specific.
Okay. In the chat, if you could.
So you can kind of go a lot of ways with that response.
Okay. Well, while we get the details on the swishing, the follow-up question on the bleaching is, can they make your teeth translucent?
They can. They can. Some of these products can be very aggressive. And, once again, the professional assessment will guide you to the proper product for your needs and for your health. But yeah, some of them could be damaging. Some of them could, I think we all heard about, some of them could result in sustained sensitivity and things like that.
Mm-hmm.
So as far as translucent enamel, it's a concern. Yeah.
Okay.
I think the right form and the right product has to be delivered for the right patient. So I think it's important to have that assessment.
So it's about you, the individual, not a general.
Oh, absolutely. It's very individual.
Okay. Okay.
And it's definitely not a one size fit all scenario. So yeah, I appreciate that question because that's important. I don't think I mentioned that when we started to discuss it earlier. Yeah.
Awesome. And so the clarification on swishing is swishing mouth with water or mouth with mouthwash, especially pertaining to dry mouth. Like swish, swish.
Yeah. Oh, wow. So, okay. All right. As far as dry mouth goes, there are a number of reasons why patients experience dry mouth, and there are products that assist and medications that assist with dry mouth. So those products have specific usage instructions. So I'll kind of leave that there. As far as typical mouth rinsing, as far as mouthwash daily, every other day, it can be very healthy. I think a lot of these over-the-counter products tend to have a bit too much alcohol. I would kind of steer one towards the products that don't have alcohol, There are non-alcohol-based products, because a lot of the alcohol-based products will essentially result in dry mouth with long-term use. So, but swishing, generally speaking, can be very refreshing and very helpful and very healthy.
Okay, that was a good tip about the alcohol. I would have never thought about alcohol.
Oh yeah, oh yeah.
Okay.
Yeah, I would avoid the alcohol-based products.
Awesome. So we're going to twist this question around a little bit, because one of the things that we definitely wanted to talk about were things that kind of take away from the healthy smile, such as the red wines and the coffees. And can you just share
the good stuff? Is that what you're referring to?
Pretty much.
Yeah.
Everything we like in life.
You're correct. We all heard about the soda, the chocolate, the red wine. That we call them the oral health offenders. Here's what I would say about these things. It's truly a moderation factor. I think moderation usage of these consumables and your daily oral hygiene typically manages the whole scenario. I think over usage, if you will, whatever it is, I think moderation is the word in that respect.
Okay, awesome. So as we are in a pandemic, and thank you for sharing tips on keeping our smiles looking magnificent so that we can be fashionable, but we still need to go to the dentist. And I know myself personally, I've got a lot of fear around it in the middle, even if it weren't a pandemic, but especially because of the pandemic. Can you just share some thoughts on that?
Yeah, actually, very timely question. Okay, so what we know now as far as the virus is concerned, we do know that the virus is spread via aerosols. Unfortunately, what we do in dentistry, a lot of what we do generates aerosols. But most dental offices are very, 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 very prepared, and have been, I must say, for years, for preventing the spread. And what I mean by that is the protocols that we take, the protections, the covering the instruments, the sterilization of the instruments, prepping the chairs, protecting the patient. In fact, actually, so it's been a year now. So the American Dental Association actually did a study back from last March about how well dental offices in the country are doing as far as controlling the spread. In fact, the infection rate associated with dental offices is below 1%.
Oh, wow.
So that, the fact that we are and always have been prepared, the PPE that your dentist has and always been using is what obviously is recommended now. Certainly in offices, we take the social distancing into hand, but so, I think that study was refreshing, because we've always protected ourselves, our staff, and our patients. So
that's awesome to hear. Definitely. And I see in the chat that the dentists have always been ahead of the curve. And my mom said,
amen. Yes, that's correct. Yeah. I couldn't have said it better. That's right.
Yeah. Yeah.
But that should give you some satisfaction and some confidence to have no problem visiting, your dentist in the current condition.
I think there's a fan of yours in the audience, Alban Burke, who says excellent information.
Okay, Barry's actually my brother, but yeah. Yes. Thank you, Barry.
I'm trying to see if there's any other questions as we are thinking about our most, what I like to call our best fashion asset, our smiles.
That's right.
And actually, you touched on something too that I did want to talk about, were implants. And implants on the impact of smiles. Thoughts on implants and what they could mean?
All right. So dental implants have been around for about 35, 40 years now. So they're pretty tested. So they are an option to replace teeth that are missing or lost, and they're a very solid, very uh, cosmetic, very straightforward as far as the procedure option to replace missing teeth. And once again, I think specifically you have to have you have to be evaluated for implants and see if you're a specific candidate. But they can be a very healthy and very aesthetic replacement for missing teeth. Yeah, so I think they're very commonplace today. So I would totally recommend it for any patient that is considered for it.
Awesome. And I think we have time for one more question.
Sure.
What's the best materials for fillings? And actually, this has come up even in talking with my dentist. Like, what are the best that we should be thinking about and healthy?
Best. Okay. So, when you say best, I think, all right, I will start with the more cosmetic restorations. I think fillings of today on the cosmetic side are the tooth colored fillings that we match the shade of your teeth and restore the tooth. Very great option. Beautiful and yes, healthy. Now you have to remember these resin restorations are not necessarily the restorations that uphold the wear and tear the longest or last the longest, if you will. So there are other options. So, best is, I guess, a relative term in that respect. But I would say this on the cosmetic side, I think probably 85 to 90% of our restorations are the resin restorations. I think that's what we probably mostly do now.
Okay.
That's where the demand is, certainly healthy again, but cosmetically speaking, they look like teeth. They look like natural teeth.
Okay. There's a question.
Every once in a while, you get a patient that wants a silver filling, amalgam restoration, but for the most part, I say the resin, the tooth color restorations, yeah.
There's a question in the chat, and Zena, yes, we're going to answer that question as well, about asthma medication and how it potentially whitens your smile. I mean, how it yellows the whiteness of your smile. And the follow-up on that is that medication or medications that actually discolor the teeth, are they causing any other detrimental impacts?
Wow, that's a really good question. Real comprehensive question. Yes, they can cause, and they have been known to cause actually breakdown of the enamel, discoloration. What we recommend for our patients who take those whether it's the maintenance drugs or the daily rescue asthma medications, or actually most of the asthma medications, what we recommend is when they take their medication to typically rinse really thoroughly, brush if they can, sometimes they cannot, but just rinse thoroughly, because you don't want that residual medication on the hard tissue, because there are some serious detrimental side effects as far as that's concerned.
Awesome. No, I mean, this was great information as we're focusing on creating our best selves. And probably the most important question, which is a good sign that the audience has enjoyed, is the question here in the chat is, where is your practice?
I currently am part of a large medical group. Our group has 6 dental locations. I'm the chief of the department, so I kind of float around between 3 or 4 of the locations. We're in Orange County, New York. I spend a lot of my time, the majority of my time, in the Newburgh location. So yeah, Orange County, New York, Newburgh proper, Newburgh, New York.
Awesome. All right. Well, we are at 20 minutes. But as I see in the chat, it was great to get so much information in a short period of time. So I want to say thank you, Dr. Burke, for not just making the time, but also given some real thought on the questions of how we can have our best smiles.
Thank you for the invite, and thank you for the thoughtful questions. I appreciate it.
Yeah.
Thanks again, Jackie. Good to see you.
Yeah. Hold on for a minute. And
Okay.
audience, thank you. Everybody's saying thank you. And I appreciate everybody being here as we do on Wednesday night. I look forward to seeing you next Wednesday. We're about to head into Fashion Week, so we'll be talking about the upcoming trends for this fashion season. So hi, Leah. Thanks for joining us. And I will see you guys next week and hang out with
Smile fits with all the trends. That's all I know. All right.
The healthy smile. Thank you.
A healthy smile. Amen. Yes.
Thank
all
you.
right. Good night. Yeah.